Hey everyone, and welcome back to Data Driven Health Radio. I'm your host, Dave Korsunski, and today we have the great pleasure of speaking directly with the gentlemen from OxyHelp, who are making some of the most cutting-edge hyperbaric chambers on the market. And we're going to dive deep into all things hyperbaric therapy today. Valentin and Dieter, welcome to the show, gentlemen.
Thank you.
Thank you for inviting us, Dave.
Yeah.
Thank you for having us.
So, Valentin, we've been working together now for, roughly 18 months on figuring out how we can link up the OxyHelp chambers with Heads Up to track outcomes. But what I really want to dig into today is OxyHelp in general as a company and the incredible work you guys are doing to make this therapy more accessible to people, both for home applications and also for clinical applications. So I'd love to just start off with the founding story of OxyHelp. Now, Valentin, you gave me the story a few months ago when we had the pleasure of having dinner together in Miami, and I got to learn a little bit about your background and what led you into this industry. So, Valentin, maybe you could start off and just tell us how you got into this business and tell us how you got into OxyHelp. And then, Dieter, we'd also love to learn a little bit about your background as well. But Valentin, why don't you start us off and tell us the origin story of OxyHelp?
Well, Dave, I did my master's study in Japan, and I lived in Japan. And about 16 years ago, I came across what in Japan they called in Japanese it's called sanso capsules, being translated in oxygen capsule, right? So they have the pressure is limited to 1.3 atmospheric pressure, but I could experience the first time in Japan with these oxygen capsules. Found it interesting. I looked a little deeper into hyperbarics, what exactly that is. And from personal experience, family members, they had health issues. Talking about my father and my mother-in-law, I started by I shipped the chamber from Japan back home to help with their health conditions. And we could see my mother-in-law, she had cirrhosis at that time. It was quite bad stage. And we see that's helping her along with obviously other therapies. And then I've seen also great improvements with my father. He had the mobility issues with the blood flow, and we could see that in a couple of months. I could see the improvements. And then obviously I became a lot more interested, and I started working initially with a Japanese manufacturer. The thing is, the Japanese are a little bit more conservative, and then the Europeans, we like bigger chambers. We're looking into different designs. I would say the Japanese manufacturer would not be that flexible. So about 12 years ago, I decided to start my own company and produce these chambers. It's been a long journey. I mean, I think it's 11 years ago when I started OxyHelp. So by now we have somewhere close to 3,000 chambers worldwide. Initially we started with a monoplace chamber, and then a couple of years later we started developing the bigger chamber. Then I would say something like 2 years ago we realized how important, especially for the private people, how residential, how important it is to adapt the chamber to their lifestyles. Because I would visit like clients, and I see that in 1 year they only use the chamber like 20 hours. I said, it doesn't make any sense. He said, and they tell me I don't have time for it. So then let's make sure that we build your chamber you can integrate it in your daily routine. So yeah, not to elaborate too much, but then we start from a monoplace chamber for a classic shape that you see, a laying down chamber. We have now various models, customizations. We try to adapt the chamber according to your lifestyle. So I can say here that the luxury chamber, Dita can be able to talk more about that, is our top of the line product with the noise reduction. Then we have the hyperbaric gym, which seems to getting a lot of tractions lately. We have the gaming chamber, the office chamber.
Awesome. So I think that's an important point you made there, Valentin, which is you recognize the limitations of a traditional monoplace chamber just in terms of the utility in a person's day-to-day life. Obviously, that's very different from someone who needs it for a very serious medical issue, where you're obviously a lot more motivated to get in there on a regular basis. But as you stated, for just general day-to-day use, health optimization, longevity, you recognized an opportunity to create a new form factor which allowed it to be more easily integrated into day-to-day life, which I think is brilliant. And I think you're seeing the results of that. So I want to talk more about the evolution of the industry over the last 10 years, from where you started to where we are today, and some of the new models you're bringing to market. But before we do that, Dieter, welcome to the show. We'd love to learn a little bit about your background and your role at the company as well.
Thank you. Thank you, Dave. So my background is very much of coming from the service industry. I've been working there for 25 years and mainly in management positions. And having done that for quite a while, I recognize that my health is slowly but constantly deteriorating and not having the energy anymore to do it more than that. So I saw myself in a position to change my life. And that's what I did, something like 15, 17 years ago. And I decided only to go partly into management consultant mainly. So that was quite unstressful. And the more I got out of this business, the more I got into the health, because I cared for myself, I cared for my family and for friends. And the more I digged into it, the more I found these very interesting modalities and devices that would help me to speed up that process. And the hyperbaric oxygen therapy was the booster of all of them. So meeting Valentin and OxyHelp was really a game changer in that process. So everything that I started until then really got a boost for myself, for my friends, for my family. So I dig more into this thing, and I thought it's a fantastic product. Why not having that in a way that is so luxury that as you would sit in a private jet, let's say it like this, right? Very quiet, very comfortable, very good seats, all the comfort that you think of. If you combine that with the health issues, you would find out that the impact that such a therapy could do to you would increase a lot more, because, as you know, parasympathetic activation is one of the keys that you have to activate to make sure that everything you are doing has the most impact. So that's what we planned, and that's what we started together, and we have been successful with that project very much. It's very much appreciated in the market right now, and that's the way forward, and it's a huge success so far.
Yeah, congrats on the success of the company in general.
Thank you.
Valentin, you started this company 11 years ago, you mentioned. The industry was very different back then. I started building my software, heads up, 11 years ago. And the industry was at a very different place. The perceptions that people had around their own health was at a very different place back then. There were some early communities of people that were going down this path of just not accepting the conventional paradigm of health, where we go to a doctor and we have our visits and then we go back home and we go to our daily life. And we're in a completely different time and space now, where I think everyone is starting to think differently about the ownership they take over their own health. And you've been able to watch this industry evolve from the hyperbaric oxygen side of things. I've been able to watch it evolve more from the all of the different ways we can measure our health. But I would love to hear, Valentin, for over the last 11 years, just in your own words, how have you seen the industry evolve, and how have you seen the market change and the demand change for hyperbaric therapy since you started to where we are today, where you're building luxury chambers with gyms and gaming stations and podcast studios? Compared to where you started, can you just share it a little bit in your own words of the evolution of the industry as you've seen it?
Yes, Dave, as I mentioned before, we started for a few years. We had just a laying down chamber. You're confined to this position. There's obviously not much that you can do. You do have a TV outside it and a Bluetooth speaker, so you maybe watch some content, but you kind of limited to that, right? When we like 11 years ago, if I look at the clients that we're having at that time, would be, I would say mostly the commercial clients would be over 80% commercial clients, and we're talking about rehabilitation centers, chiropractitioners, small healthcare practices, and those, let's say, around 20% residentials. They're mostly people with a medical condition. We're talking about fibromyalgia, Lyme disease, MS. They have this unfortunate medical conditions. They get hyperbaric somewhere. They say, okay, this is helping me, and I want a chamber for myself. That was, I would say, 11 years ago. In the past few years, with the longevity studies coming out on hyperbaric 3 years ago, and then COVID, I would say maybe one day someone will write a book about COVID changes into health awareness, right? We're looking on now, it switched to where we have a 40-50% commercial on the commercial side. And again, half of our clients are residentials, and the majority of them are healthy people looking into biohacking, longevity, wellness. I'm really happy to see that, actually. So that's been, even if you're looking probably in Google, I was talking to the company that's doing the marketing and say, look at the searches on Google. Like, you got 300% growth on hyperbaric knee, that in the past few years, right? To get that growth every year. And again, on the commercial side, instead of, let's say, what you had before, the rehabilitation clinics, on the commercial side, we do have a lot of our clients are longevity centers, health spa, hotel, resorts. They seeing where the market is going, and they all want to include hyperbaric as along with other, let's say, a red light bed, a cryo chamber, IVs, cold plunges. They want to include it in their package.
Awesome. So almost a flip completely on the business from where it was perhaps initially 80% commercial, 20% residential. Now you're seeing it's closer to 50-50
Yes.
at this point. And the applications for hyperbaric are evolving. I've seen some of the studies out there around how the therapy works on things like the telomere length, on the aging clocks, and it's consistently coming up as one of the most effective for all things longevity. And so I think, just the longevity market as a whole has started to really accelerate. So I think the timing has been good, and you've been able to evolve with the market, and you've also been able to innovate with the market. And when I see what you guys are doing on Instagram with all of the different types of applications for hyperbaric therapy, it's very exciting. And I hope that we continue to see more people who can start to gain access to this therapy. Because I remember, Valentin, before I met you, I wanted to put my father in a hyperbaric chamber, much like you did and much like Dieter did. And at that time, you could find a hyperbaric clinic in your local area, but you're going to go in there, you're going to get a package of 10, 20, 50 sessions. It's going to be $2,000, $5,000, $7,000. And it's just a point in time group of sessions. It's not really something that's accessible to use over the course of your entire lifetime. So I think that I'm excited to see more opportunities for more people to engage with this therapy. It's just becoming more ubiquitous, and there's more ways to get this into the home. So I'd like to see that trend continue. Dieter, maybe you can pick up on what Valentin said, and he made an interesting observation about the Google searches, which is always an interesting trend. You can start to see when a particular area of health is really starting to pick up steam. I remember when I first started building Heads Up, at that time we were seeing that same hockey stick on the curve for the ketogenic diet. And at one point then we started seeing the hockey stick on the curve for the word biohacking. And now hyperbaric therapy, I think, is one of the hottest topics in longevity, in my humble opinion. But Dieter, can you comment a little bit more on the business side of just what you're seeing in the overall growth of the market and the industry trends that are making this more interesting from the business side?
Right. I think the driver for much more intent of people looking at the technology is the understanding of the people that the very foundation of health is oxygen, the underlying foundation.
Yep.
So with all the good podcasts out like yours, people are getting more and more information on the real basics of how the body is working, how it's functioning, and understanding the role of oxygen is really one of the major keys to health. So having that as a driver, from my point of view, is one of the main causes, be it in the health section, be it in the longevity area, or be it in the sports area, recreation, performance increase, things like that. So in all three areas, we see that the information in terms of the oxygen, the role of oxygen is the real driver, and understanding how mighty hyperbaric oxygen therapy is in terms of flooding the body with oxygen is something that people are excited of if they understand the story of hyperbaric oxygen mechanisms in the body in terms of what happens with oxygen in the body. That is the most exciting thing, and I see this as the main driver.
So, Dieter, you made a good point there about professional athletes that use hyperbaric therapy. And you guys may know this better than I do, but I think I was even told that Novak Djokovic, the tennis player, actually travels with a hyperbaric chamber wherever he goes. And I think I heard that LeBron James has 3 chambers, presumably in various locations, wherever he's going to be, because it helps with physical recovery of the body, aerobic capacity, energy levels, among other things. So a lot of really powerful therapies are initially used in professional sports, where there's oftentimes a huge financial outcome tied to an individual performance. As you guys may know, professional athletes is where a lot of the early interest in heart rate variability training was concerned. So I think, would you say, Dieter, that sports and high performance athletes are perhaps where a lot of the early applications of hyperbaric therapy came in outside of just pure clinical usage? I mean, Valentin mentioned that initially he was seeing people with fibromyalgia and Lyme and MS, but on the other side, you had these extremely high-performing athletes that were using hyperbaric therapy. So I guess my question is, maybe you can just explain how hyperbaric therapy is used in sport, and then we can expand on that a bit in terms of how it's used in day-to-day life. So from the professional athlete side, maybe you can just comment on that.
Right. So understanding the mechanisms that, especially when you're doing sports, the main reason why the body is exhausted is the lack of oxygen, right? So if you're running and you're getting out of breath, or your muscles wouldn't work anymore, it's mainly the cause that oxygen is missing in the tissue. So once you get that oxygen into the tissue, it would help to increase the performance. And that's what you can do before you're doing sports, while you are doing sports. So if you are doing in our hyperbaric gym, if you're doing sports in our hyperbaric gym, you can increase the performance. If you, let's say, for example, you can do 20 kilo 10 times and you go in a hyperbaric chamber and you do nothing else, all of a sudden you could do more of it. Why? Because there is more oxygen and there is a later point in time where this muscle would run out of oxygen. So you have a very good training effect within the chamber. You would have a very good recovery time because all the acids are piling up in the muscle if you have overdone. So you can get rid of that and you can recover so much better. And the next day you can immediately start with the training again instead of having a break after a very hard match, for example. So these are some examples of what you can do to increase the performance and increase your capacity from an athletic point of view.
If I may, Dave, I want
Yeah, please
to
go ahead, Valentin.
elaborate on how the hyperbaric gym started.
Yeah.
I was quite frustrated. I never had time for my exercising, for rower, and for for doing the chamber. Right, I travel a lot, so I had in my house. I had a chamber with 4 seats, and then a couple of months ago, I asked my colleagues, okay, just let's remove the seats. I want to put a rower in there. My initial thought was that I'm going to do the rowing 20-30 minutes. I'm going to stay another 20-30 minutes. So in 1 hour, I do my exercise and I do my hyperbaric. To my amazement, the first thing that I realized when I started rowing inside the chamber was that I'm almost never out of breath. I know typically when I'm rowing, I'm talking about, let's say, depending, 16, 18 intensity out of 24. 10, 15 minutes, I'm out of breath. Well, I have to stop, right? When I doing the chamber under pressure with oxygen, I'm as I said, almost never out of breath. My hands are tired, my legs are tired, but on the breath work, I'm just doing amazing. So in numbers, I can tell you exactly I'm doing a lot more. Usually it takes me, as I said, if I do 18, 20 intensity out of 24, if I really want to push myself, it might take me like 40 minutes to complete 8 kilometers. I complete that in 30 minutes in the chamber, like 10 minutes faster, and I'm not tired when I'm coming out of the chamber. Right? I feel I can start again. I became a little bit more interested, and I came across to a meta-study analysis on multiple studies about exercising and recovery after exercising with a hyperbaric chamber. So these studies they shows that okay, if you go in a chamber after a long training session, it will help your body recover faster. This was the feedback that I would have from some professional bodybuilder. They will tell me, look, I do a hard training session. It takes me 4 or 5 hours my body to recover. I go in the chamber 1 hour and I'm ready to go start training again.
Wow.
But the most, I would say, according to this meta-study analysis, the most benefits you're getting exercising inside the chamber where you're able to push the threshold of aerobic stage. We're talking about aerobic training where your body can supply enough oxygen for the effort you're putting in. And the moment when you're out of breath, right, and you go into anaerobic training when your body starts burning glucose and other compounds, and then results in the lactic acid that creates the fatigue. So I'm a big fan. Not only that I'm saving time, but it's just another good thing that I like. My experience. I have small kids in the house. If I try to work out, they come. It's a lot of disturbance, phone calls, everything. I lock myself in the chamber. It's me, just me, the rower. I don't usually do dumbbells, but I have this. It can be equipped with dumbbells as well. In 30, 40 minutes, I'm doing the rowing, I'm watching the news, I'm doing my hyperbaric. So I'm time poor, right? So for me, it's been only without any synergy, I would say that this would be enough.
Well, you bring up another point, Valentin. I know how much you travel, and you're constantly all over the world, meeting with customers, setting up chambers, different time zones. You're running a huge company, a growing company, and there's just the demands of even showing up every single day with the physical capacity and the recovery that you need to do what you do. I mean, one minute I'm talking to you, you're in Japan. Next minute we're having dinner in Miami. The next minute you're back in Romania. So there's also applications just for people who are really, really pushing themselves at the extreme levels. Whether you're an entrepreneur, a business owner, a CEO, someone taking care of a family of kids. So this therapy also is, as you mentioned, for people who aren't sick, but for people who are really pushing themselves at the highest level, physically, mentally. So for executives, I think there's also an application where this helps us recover every single day so we can just show up to do whatever it is that we want to do in life at our highest potential. So I think for someone like yourself who's all over the world traveling, is there benefit just in terms of the ability for you to do what you do every day? I mean, could you execute at the level you're executing at without the ability to rejuvenate in the chamber? So maybe you can just speak to applications you're seeing from CEOs, executives, high performers, people running companies, people who are really just pushing themselves to the limit. I presume those are a lot more of the individual chambers you're seeing for those types of people. But can you comment more on executives, business people, just high performers in general using hyperbaric therapy? People who travel like crazy.
That's exactly the feedback that we are receiving. So mental sharpness, being able to work during the day without the dip without performance dips during the day. That is some of the benefits that you can achieve and that people are achieving doing that therapy. And I'm doing the same thing. I mean, 65 now, and I have so much more energy than I had with 48, right? When I really had my weak points during the day, and now I'm able to work throughout the day and still being fit in the evening. And that is something that people, executives, mental sharpness, and that they really appreciate and are really thankful on this kind of technology and therapy, right?
Yeah, I think it helps a lot with just preventing burnout from
Right,
people who
and
are
it's
going
not
really
just
hard.
experience; it's studies as well. Studies show that this is the effect of a continuous or a hyperbaric therapy over a period of time. You won't reach that with one or two therapies, right? You have to do it
Sure.
over a period of time,
Yep.
because then you get the full benefit of this therapy, not by doing it once or twice.
Agreed. Valentin,
Yeah.
I'd like to talk a little bit more about your chamber design because it's very unique. And I remember when we were having dinner in Miami, you told me about the design you came up with the door, the way that you've installed the door and the way the door seals against the chamber as a very innovative design in the industry, which is what allows you to build these chambers that are customized for different applications. It allows you to put a rowing machine in there. It allows you to put beautiful, comfortable seating in there. So for those who are not familiar with OxyHelp and some of these new innovative chamber designs that you're bringing to market, can you explain the difference between the traditional monoplace and then how you came up with the design for the door on the chamber, which I think you mentioned to me is innovative. And it's also partly which has made it unique in the industry. So can you comment a bit on how that part works and how it's just different from the traditional monoplace chamber and how it seals and just what that allows you to do with hyperbaric that you can't do in more traditional form factors?
Yes, Dave, it is not our design. The door closing mechanism, it's been around when you seal the door just by the pressure. It's been around. It was inspired by the Japanese design. The company in Japan that I was working with, there were several other companies doing this design. Uh, this is the safest, I would say, especially for home use, for residential. This is the safest design because if you're looking at the door is only locked by the pressure. Okay, there's no locking mechanism. So we're talking about that there's been accidents with other setups where the chamber requires a locking mechanism from outside, and then in time you have the pressure stress fatigue on the hinges or something, and then you see that the people get locked in the chamber, and well, for someone that has, even if he doesn't have confinement feelings, you will get them right when this happens. So we embrace this design because I said this: if this is going to work for home use, that's the only design they would go for. As I said, the door is it's being sealed in the beginning by some air pistons. But as I said, if there is a power failure, even if the pistons are engaging, if there is a power failure, the pistons are dropping, and then the door, as there is no pressure or the pistons pushing on that, it just opens. So that brings me to obviously design and functionality and safety have to go all together, and you have to make concessions, not make safety concessions, not make concessions with the design. I would say that what the improvements that we did so far is largely due to our customer base, the experience. We clocked in my understanding, we clocked over 5 million hours of usage, right? So we didn't have, if I'm looking at the chamber that we had 11 years ago and the chamber that we have now, I said I should put that in the museum. The changes that have been not as much as say as shape, but we're talking about pneumatics, we're talking about gas management, we're talking about carbon dioxide buildup, we're talking about nitrogen buildup because you're using the air from the room to separate the oxygen from the nitrogen. So when you're looking at all these things and you want to improve the higher the ventilation through the chamber, the less carbon dioxide you have built up in the chamber, the more noise you have, right? So you're looking also at the constraints, like especially for residential, you're looking at weight over footprint ratio constraints, right? A hard chamber is a hard chamber. So I'm seeing it's a longer discussion here, but I'm seeing a lot of new manufacturers, coming out from, say, China, Turkey, and they're just cutting corners in a way that I don't think it's safe, right? When you have a pressure vessel by design should be a round shape, right? So when you see these designs, this non-standard geometry for pressure vessels design, they look very scary, right? And obviously, when you have flat surfaces, well, I've seen different designs like this with flat surfaces, they require a lot of reinforcement. And then that chamber becomes heavier, and you have to look over you put in a house, you have to look at the weight over the footprint ratio, because
Yep.
in most cases that's not, let's say, standard accepted weight over footprint. There's so many, I see other designs where you have which is not normal for a pressure vessel. You have cutouts, next to cutouts. They want to make the chamber sexy, beautiful. They say, okay, you're going to have a big glass in front. You're going to have another big glass on the side. And you're going to have a door on this other side. And it's just not possible. The more you cut out from the body of the chamber, the material is not consistent. The more pressure, stress, fatigue you have on that. I would try. After this, 11 years, I would like to make a chamber with, more windows, bigger, larger windows. But there's so much you can do. You have to look first at safety. You have to look at the pressure, stress, fatigue of the materials. You have to really test it, and then actually do it and put it on the market.
So maybe Valentin, on that note, you can comment a little bit about the safety record of OxyHelp. I mean, you've got 3,000 chambers out there in the wild, and so maybe you can just comment on the track record for you guys as a company.
Yes, absolutely. I would say that the only, let's say, the only thing that we have And a monoplace initially was says, okay, some people, we, even in the risk assessment, we did that, if you sliding the door closed, it's like any other door. You have to watch your fingers, right? And then we put big stickers like, okay, just watch your finger when you're sliding the door, make sure that your fingers are not in there, right? But otherwise, as I said, in 5 million hours of usage is, take into account, because as a manufacturer, when you put a product in the market, you have to take into account the stupidest thing someone can do to hurt themselves, right? So you're looking at that and you're looking at all the possibilities, right? So let's say in our chamber, you're alone, you are sleeping, you don't realize there is a power failure, right? And what happens when there's a power failure, the chamber will decompress naturally. They have naturally open valves. They will let the air out. When there is no more pressure, the door falls on its weight, leaving you room to breathe, giving you fresh air. But take the case of the soft shell chambers, right? These accidents that can happen. I had experience personal being in a soft shell chamber. And that's why I realized how risky it can be, because it's pressurized. It stays, if you have a power failure and you're sleeping, it just stays pressurized with the limited amount of air that you have inside. And you start building carbon dioxide levels. Obviously, 3,000, 5,000, 6,000 might be okay. But once you go over 15,000, it's a life-threatening levels of carbon dioxide in the chamber. So taking all this situation into account, it's 100, I would say 99.9 safety record. Obviously, there have been no injuries in our chamber. There have been no. Here's a chamber that's been perfected with the user experience. The advantages, one of the big advantages is that we can connect the chamber to a laptop and remotely access the chamber, update the software, look if the valves work within parameters. It's been very helpful to us. And obviously, all the other issues, maybe a trim seal that is damaged, maybe some components breaking or something. That's never been a case of let's say, possibility of an injury or something like that. It's just, let's say, the chamber doesn't work, the chamber doesn't seal. That the maximum that can happen.
Got it. And Valentin, so you've got clinical models. You've also got residential models. Are there differences in the certifications when you're going into, for example, a hospital versus a unit that's designed for home? Can you comment and I imagine it varies by country as well. So
Yes,
can you speak towards how it works, for example, in the United States with like FDA certification and that kind of thing?
That's a very good question, Dave. This is our chambers are certified in European Union with a European notified body as a commercial non-medical device under the directive of equipment for human use, right? So then we have, it's not just us. If it's not a medical device as a manufacturer, my obligation is to issue the declaration of conformity to make sure that I respected all the regulations and put it on the market. We wanted to do more than that, and we did. We certified, we went through a process of certification with European notified body. In the US, with the FDA, that's why you don't see these new chamber designs where, even though it's safe, if you're looking at a European regulation allows you, it's more acceptable with these non-standard geometries for the window.
Yep.
However, when the ASME, there's more strict with that. So they have the standard geometry. And now we're working with laboratories to be able to, because the laboratories in the US, they say, okay, we test you, even if the regulation allows you to have a non-standard ASME window non-standard geometry, the standard allows you to do that. The laboratories, they don't want to do the extra work and test that, right? So while we're working, it's still harder for us. In Europe, we manage, but in the US, we're still working to find the laboratories. They want to do the extra work and look at the design, do their testing, and say, okay, we approve this non-standard geometry window.
You've got different form factors available. You've got the traditional style chambers, and then you've also got the new multiplace as well. So depending on the application, yes, you can decide which model is going to be best for your situation, for example.
Yeah, but this, I mean, if you look at the classic design chambers in the past, you either have the monoplace, which is the acrylic tube with the end caps, the steel end caps, right?
Yep.
So the acrylic tube is a standard geometry. Now, to make it more affordable, I mean, the acrylic tube, just the acrylic tube without the other components that you need in a hyperbaric chamber is very expensive, right?
Yep.
And the acrylic tube that you have in the whole design was meant to, obviously, also to ease up with the confinement feelings, right? But if
Yep.
you look at a monoplace design, just half of the chamber is the window, the transparent window, right? That helps enough. You don't need the entire chamber to be transparent, right? So that's why this design we can have a lower production cost and we can make it more accessible.
Makes sense. So, Valentin, as we're winding down here, I think it would be interesting to see some of the new applications you're bringing to market. You mentioned a few at the beginning of the show. You mentioned the hyperbaric gym. You mentioned the hyperbaric gaming chamber. I know that Gary Brecka now is podcasting out of his hyperbaric chamber. So you've now got the hyperbaric office. So maybe you can just comment on some of the innovative ways you're seeing people start to bring this into their day-to-day life. Like you said, we're all busy. It's hard to get 90, 120 minutes where you can just go and do this therapy every day. So people are now figuring out how do they integrate this into their life. So give us a few examples of innovative ways you're seeing people bring hyperbaric therapy into the course of just their daily work and their daily life. Some of the more interesting applications you've seen out there.
Yeah, well, I do. I mean, I underline all the time how important it is, especially that you bought these for private use. How important it is to make sure that you can make time for the chamber. We're talking about dosage frequency depends on the age, right?
Mm-hmm.
Depends by only for, let's say, biohacking purposes, you're still looking, depending on the age, 60 to 90 minutes a day and be consistent about. So how we integrate that we do have, starting with the classic design for the multi-play. So you have standard seats, you have IMS, premium seats, and then with the office chamber setup with the desk. A clear point that I want to make here is that in a hyperbaric chamber, pressurized or normal air, you are allowed to have up to 24 volts low voltage devices in there.
Okay.
And not to confuse people, when a chamber is pressurized with 100% oxygen, we're talking something else. No electronics inside unless they are in an inert sealed in inert gas. So no electronics. The patient has to wear electrostatic discharge bracelet. Everything has to be cut at 100% because any electrostatic discharge is, you see what happened in Michigan a couple of months ago, right? So we're talking about a chamber that's pressurized on normal air. Even if the oxygen that comes from the concentrator bleeds into the chamber, it never goes above 23.5% the oxygen build up in the entire chamber. So then the flammability threshold of what you have in the chamber doesn't change from let's say, the normal air, right? So I'm allowed to have anything like a TV, a tablet, anything that's up to 24 volts, I can put it in there. Then we come with all these additions, like either entertainment, either computer for gaming, a gaming desk with a chair. We have some people they ask, I want the entire chamber to be a full bed, right? So I know I'm going to sleep in the chamber, so make a bed with a comfortable mattress, and I'm going to spend the time in the chamber. Those looks nice as well.
Yeah. And with the Luxes, we have even increased this bandwidth to serve those ones that want to really meditate and have a very healthy environment, being very silent.
Yeah.
So we have the most silent chamber in the world. We have built that with a level that is comparable, or that is comparable with, you compare a Golf, a car with a Bentley, right? When you're sitting in it and you see how quiet the one is and how much noise the other one is making. So that was the intention behind the Luxus chamber, to make sure that someone who wants to relax in this chamber, sitting in a maximum comfortable seat with massage and all luxury that you can think of, really is in a position to calm down completely and being silent, and whether you want to meditate or hear music or having a discussion with someone or an interview or a podcast like Gary does, that gives us the full range of possibilities within the chamber.
Yeah, sometimes for me personally, it's nice to go into the chamber with absolutely no electronics. It may be the only hour of the day where I'm not interrupted and I'm not distracted and I don't have my devices. Sometimes I'll just go in with a regular paper book and just completely disconnect for an hour. So I think what you're saying, Dieter, is you're seeing some people who are using this as a place to find stillness, and you're seeing other applications where people are using this as a way perhaps to multitask, to be able to fit this into their life. So there's different ways that people are creating the space that they want when they step inside of there, and that just depends on the individual and what they get out of it. But I do like the idea of creating it almost as a place where there is no distraction and stillness. I think that's actually underappreciated in today's society.
Right, Dave. You're absolutely right. This multi-purpose environment where the customer decides on what he wants to do, and he has all the possibilities. That's what we wanted to achieve, and that is exactly the feedback that we receive from our customers.
Awesome. Well, we could talk for hours about the physiological benefits, the biochemical benefits, the applications in everything from we're seeing research for hyperbaric therapy coming out on everything from PTSD to fibromyalgia to long COVID to brain injury to telomere lengthening to improvements in biological age, wound healing. I mean, there's an unlimited amount of subjects that you can dive into on the therapeutic benefits. What I really wanted to do on this show was introduce the innovative ways that you guys are bringing this technology to market. So if people are listening, Dieter and Valentin, and they want to get more information from your company, where would you direct them?
I mean, with the caveat that our website it's 6-7 years old, and we don't the website has not been updated to what we're doing lately. And I'm sorry for that, but it's just been a company more like a knee-jerk reaction. We had to do more chambers, we had to do them better, and the website was kind of the last thing. But nevertheless, as a matter to contact us would be OxyHelp.com website. There is a way that they can leave their contacts, and we will follow up with that.
Awesome.
Yeah, and social media as well.
The social media, obviously, the social media channels, OxyHelp Global social media, yes. Right.
Well, thank you guys for making time here today. I've been a huge fan and a personal user of your chamber, as well as my closest family members and loved ones, and it's been incredibly beneficial in my father's health, in my own personal health, as a business owner, as an entrepreneur. It's incredible to see the work you guys are doing to bring this into all kinds of different applications where this becomes more accessible. It's not just this medical treatment that you get for certain FDA conditions that may be covered by your insurance. And there's a very small list where you could actually get this therapy. This is now becoming accessible, and it can have benefit to a lot more people. So thank you for all the great work you guys are doing in the world, and we're looking forward to more continued partnership between Heads Up and OxyHelp.
Thank you, Dave.
Thank you for having us.
Thanks, guys.
Well.
Thank you for listening to Data Driven Health Radio.